Good evening and welcome to Doctors on Call. What are the predictions about this year's flu season and how will the flu shot measure up? What other infectious diseases should we be on the lookout for? And what should we know about keeping up with our immunizations and booster shots? I'm Dr. Alan Johns from the Department of Family Medicine and Community Health at the University of Minnesota Medical School Duluth. I'll be your host tonight for our program on infectious disease and immunizations. We'll be happy to answer your questions. Just give us a call locally, 218-788-2844, or toll free at 1-877-307-8762. I'm pleased to welcome our panelists this evening. Dr. Paul Sanford, an internal medicine specialist with St. Luke's Internal Medicine Associates. Dr. Stephan, an infectious disease specialist with Essentia Health, Duluth Clinic. And Dr. Tyner, an infectious disease specialist with St. Luke's Infectious Disease Associates. When you call tonight, you'll be talking to one of our medical students. Ashley Forstrom is from Clara City, Minnesota. Anthony Hacker from Alexandria, Minnesota. And Alex Sauer from Brainerd, Minnesota. And now on to tonight's program on infectious disease and immunizations. Well, Dr. Sanford, it's flu season, or it's going to be starting anyway, and everybody's talking about the flu shot. So who should get the flu shot this year?
Everybody should get the flu
Everybody.
shot. Everybody should get the flu shot. If we can prevent suffering and death, the vaccinations are very worthwhile. And I don't think there's any excuse for anybody not to get the influenza vaccine.
Dr. Stephan, why do we have to get it every year?
Well, the thing about influenza is that it changes in a way that our immune system doesn't recognize it. So you have to stay up to date with the most recent vaccine so that you can protect yourself maximally.
Thank you. And Dr. Tyner, I have patients coming and say, well, you know, whenever I got the flu shot, I'd get the flu, so I'm not getting it anymore. What do you say to them?
I'd say I have a lot of people tell me that, or at least they feel like they get the flu. One of the ways you know the flu shot is working is when your body develops an inflammatory response to the flu shot. So a lot of people feel the muscle aches and feel like they're getting sick because their body's reacting to the flu shot. Mm-hmm. It's actually a good thing. On the other hand, some people already started to get the flu before they had the flu shot or started to get a cold, and they can confuse that with getting sick from the flu shot. But the flu shot actually can't give you the influenza virus.
Oh, good. Well, thank you. So, Dr. Sanford, why do we give immunizations against, say, shingles, and then people will get shingles, and they'll say, well, the shingles shot didn't do anything. I got shingles anyway.
Yeah, and unfortunately, it would be lovely if the shingles vaccine guaranteed people would never get shingles. That would be terrific, because shingles are hideous. But there may be some protection from this terrible thing after the shingles called post-herpetic neuralgia, where the nerve is just on fire, like somebody poured boiling water on that stretch of skin. If there's something that will help that, hallelujah.
Dr. Stephan, what about the inhaled, the nasal spray for influenza? Apparently that's just not going to be offered this year because it's not effective?
Well, it's been an attractive idea because people who don't like needles, and especially children, but even adults who don't like needles, it was an alternative that was available. And it's still available, but it's not recommended. And the reason for that is that it's been disappointing in its level of protection over, I think, 2 of the last 3 or 4 flu seasons. And so the official recommendations and guidelines this year are going to recommend against getting the inhaled version and to stick to the inactivated versions that are not live and that are given via a shot.
Thank you. Dr. Tyner, are there any new immunizations we need to think about?
New immunizations. Well, there are immunizations for different age groups that you need to be thinking about as you're working up in years. So as you turn up towards age 65 and older, you need to get a pneumonia shot if you hadn't had one beforehand. And getting a shingles shot is also something you need to have over age 65. There's a lot of new vaccines coming down the pike, things that people are working on. We always hope that more vaccines will be coming out because we'd like to prevent infections.
Thank you. Dr. Sanford, we have a caller would like to know how soon after you get shingles should you get a booster shot of the vaccine?
Controversial. There's no better vaccine than the infection itself. I am going to have to defer to my two learned colleagues here. I'm assuming not within 1 year. What do you guys think?
Actually, what I've told patients that have shingles is, when they've healed up, they do have some boost in their immunity, but that fact that they've had a shingles episode suggests that maybe there is a weakening of their immune system relative to when they were younger. And so, I think that as long as they're not dealing with another active infection at the time, once they've healed up their lesions, they can go ahead and safely get the zoster or the shingles vaccine.
Thank you. I want to ask a question too about this, Dr. Stephan, about this herd immunity, which people talk about and sometimes try to rely on. I know that I just saw an article about measles outbreaks and people who assume that there's herd immunity and there really isn't. What's that all about?
So when a large amount of the people that live in the community are receptive to getting vaccines and are protected, then if a infection like measles tries to resurface, it really has nobody that it can get infected that can be a source for causing the infection to spread through a given community. But now more and more we're seeing reluctance in some areas for children to be vaccinated against the usual childhood illnesses like measles. And so that level of protection in the community has fallen below a very important threshold in some communities. And so if measles is then introduced, there's many children who haven't been vaccinated properly or even at all, and they're going to be susceptible to it, and that's going to help spread it around the community. And so that concept of herd immunity is important because it does help protect the vulnerable, people who don't have good immune systems and who have other health problems, the elderly, the very young. And if not enough people get the vaccine, if there is introduction of the infection, some that we had previously felt were pretty much eliminated are starting to resurface, as you pointed out, measles being one prime example.
Herd immunity is not an excuse not to get the vaccine.
Well, and we're losing herd immunity too. So really, it really is important for everybody to take personal responsibility for their part in protecting not just themselves, but those they care about.
Thank you. We have a caller who would like to know, and this is an interesting question, does leaving dirt on your vegetables help the body? And I've seen something to the effect that, well, please explain.
Wow, that's a great question. It can, in some ways. So there's actually a fantastic study that said, the title was actually Let Them Eat Dirt. So it was about children gaining immunity or gaining exposure to allergens in their environment by being exposed to things like dirt on your vegetables. I think it's a good idea in today's day and age to actually wash your vegetables, largely because you have pesticides out there too. So there's other things, not just dirt. But the idea that exposing yourself to allergens or to the environment has a lot of foundation in science, but I would still wash your vegetables.
Yeah, I think that'd be wise. But yeah, I saw something about children who grow up on farms have fewer allergies.
Yeah, or eating local honey, just being exposed to what's in your environment, have fewer allergies. So I would wash your vegetables, but don't be afraid of dirt.
Thank you. Thank you. Dr. Sanford, a caller from Rice Lake, would like to know, is there a chance, after you've been treated for Lyme's disease, is there a chance that it could come back?
Certainly. The little critter that causes Lyme disease, Borrelia burgdorferi, is a funky little bacteria and it has a lot of different cousins, and you're potentially able to get it again. I don't know how many different strains there are of Borrelia or Lyme disease, but it's something always to watch for in our neighborhood.
Dr. Stephan, here's a very important question. A caller from Duluth would like to know, has a cure for AIDS been developed? Or why do we hear about it less?
Well, a cure is elusive, and the problem is that the virus is rapidly changing in a person's body, even multiple times per day. And the number of viruses that our immune system, it's not one infection really, if you think about it that way. The number of viruses that our body has to deal with, or that a vaccine developer would have to deal with, is daunting. And so it's been very challenging to come up with a protective vaccine that would prevent acquisition of HIV infection. And then the standard treatments, even the best, most powerful drugs that are available now to treat HIV, merely rein it in and control it and suppress it while the individual's on those medications. They don't actually affect a cure. So at this point, as we sit here now, there is not an effective cure for HIV other than preventing transmission, which ultimately would lead to elimination of the infection from society. But in the given individual who's living with HIV at this point, unfortunately, there's not a cure.
But there's great treatment such that it's prolonged into, it's more of a chronic disease.
That's
now
exactly
than
right.
it is
People who are living with HIV, if they take medications and follow up regularly with their provider, can expect to have a lifespan in the modern era of HIV treatment that's very close to people who don't have HIV at all.
That's amazing.
It's a
It
miracle.
really is. Thank you. Another caller here would like to know, how long is the shingles vaccine good for? Any ideas?
That's a great question also. It's thought to be effective for at least 10 years. There's some thought that the vaccine efficacy may wane somewhat after that, but it's thought to be good for up to 10 years, probably longer.
Thank you. Dr. Sanford, here's a question here with, I'll rephrase it a little bit as a caller from Gordon, wondering about, does the change in the flu vaccine or how flu changes have anything to do with feedlots? And I mean, there's two separate questions, sort of. But I guess what I would rephrase it is, what about antibiotic use in all the cattle? I guess is what I would wonder about.
Yeah, and with influenza, there probably isn't a huge correlation at all. I'm not aware of influenza affecting cattle at all.
Pigs, maybe.
Maybe pigs, yeah, that's a closer thing. But you think about Laos, Vietnam, China, Cambodia, where the avian influenza, which is harbored in their fowl, is rarely being transmitted to humans, and everybody dreads that day if it becomes easily transmissible. That would be hideous.
Dr. Stephan, a caller would like to know, should vaccines be given if a person is immunocompromised, particularly this person is on Enbrel? And are there certain vaccines that they shouldn't receive because they're immunocompromised?
Yeah, that's a very good question too. Actually, vaccines have really been a tremendous asset to protecting people from illnesses that used to be devastating, and the vast majority of people, even with impaired immune systems, can and should receive most vaccines, but there are a few exceptions. And so a person on Enbrel, for instance, or other types of treatments or health conditions that weaken their immune system shouldn't in general receive any vaccine that is a living organism. And so, for instance, the measles, mumps, and rubella, or German measles vaccine, or the chickenpox vaccine, those are living organisms. The influenza nasal vaccine was a living organism, and so those vaccines were relatively not a good idea to give people who have an impaired immune system. You have to still weigh individual cases, because there are some people who, if they live in a high-risk setting, you may wish to discuss whether or not it would be the benefit of getting a vaccine might still be worth it. But in general, there's a cautionary note put out about giving people live viruses or live vaccines if they have a suppressed immune system.
Sure. Dr. Tyner, that gives us a question regarding flu vaccines. Are there some people who really shouldn't get the flu vaccine? Are there real contraindications in some people?
Very, very few. For the longest time, there was thought that people who had an egg allergy, a severe egg allergy, shouldn't receive the flu vaccine. That's not true anymore. They actually have a vaccine that is safe for people who have a severe egg allergy. It doesn't involve eggs at all. Very rarely people who've had something called Guillain-Barré syndrome. If you've never heard of it, you probably haven't had it. So if you've ever had Guillain-Barré syndrome, it's something we recommend at least talking to your doctor about and potentially not having the flu vaccine. Very, very few people actually shouldn't have the flu vaccine, though. Most people should.
Thank you. Dr. Sanford, a caller from Duluth, would like to know, is there a difference between the regular flu vaccine and the flu vaccine for people age 65 or older?
Sure, you'll hear about the quad strength, where it's just beefed up, a stronger concentration. It's the same organisms that it's protecting you from, but it's just a bigger wallop, more bang for your buck.
Excellent. Thank you. And caller, Dr. Stephan, should people over 65 delay in getting the flu vaccine? I think what they mean is it too early to get the flu vaccine now?
Yeah, no, that's a question that people ask me often, and because there's concern if you get the flu vaccine too early in the season, before flu is active in the community, for instance, or we're, like in the summer months, because now it's coming out earlier and earlier. In fact, I think some places, retail pharmacies, for instance, we're getting it as the end of July. Even.
Right.
That may be too early, just because if the flu hits at the end of the winter season and kind of peaks in the February, March timeframe, especially in elderly people who don't get the boost from the immune benefit of influenza vaccines, theoretically anyway, they could be losing some of their protection by the time you get to that part of the flu season. So now is an ideal time. By all means, if you haven't had it by now, tomorrow, go out and get it. But this is because now's the time. But it really, any time that it's available, I try to use that as an opportunity. If I've got somebody in my office and it's coming up on the flu season, even if there aren't active cases being diagnosed in our community, I use that as an opportunity when they're sitting there in my clinic saying, why don't we give you the flu shot? We've got it in stock now, and then you don't have to worry about it or think about it later.
Thank you. Dr. Tyner, a caller from Duluth would like to know, does a person who has MRSA have to be on an antibiotic for the rest of their life? Can you talk a little about MRSA?
Yeah,
What is it?
MRSA is very scary when you hear about it. I think it got a lot of press a few years ago, and it's this resistant organism. In truth, MRSA is simply Staph aureus. It's a bug that we talk about all the time as being this scary thing, but it's on most people's skin. You find it in the environment, it's everywhere. MRSA is simply that form of the bacteria that's resistant to one of the common antibiotics. It's not going to cause infection unless it gets inside of you. So it can live on you totally normally and fine without any problem whatsoever until it gets inside and starts causing trouble. If you are colonized with MRSA, you don't need to be on antibiotics. In fact, it's better if you're not. The likely reason why MRSA came around to being was because we use too many antibiotics all the time. And the fewer we use, the better off we're going to be in the long run. But to answer the specific question about should I be on antibiotics, no, absolutely not, zero. And MRSA itself is scary, but in truth, it's just one bacteria that by itself doesn't cause problems until it gets inside.
Thank you. Dr. Sanford, a caller asks, and this is maybe we can help define what an infection is and what inflammation is. Caller from Duluth would like to know, what do you do about gout in your big toe?
Oh, well, there is something that's not infectious. Gout is just where you get crystals of either uric acid or calcium pyrophosphate, and it turns the fluid that should be nice and loose in the joint into a sandy crystalline stuff that makes it hurt and swell and turn red. It's not infectious, and just talk with your doc. Depending on your kidney function, there are various things that can be done to help you, but you don't have to worry about that being an infection.
Dr. Stephan, a common question that people come in with is, well, why didn't my child get an antibiotic for his ear infection? And why didn't I get an antibiotic? I've got a sinus infection. I'm blowing some junk out of my head.
It goes back to an era of medicine where those were common practices. That doesn't make them correct practices, and that doesn't mean that they were based on what we know today. And largely, the reason why we're showing what I would say is the proper withholding of antibiotics or restraint in prescribing antibiotics is for a number of the reasons that have been mentioned, like development of resistant organisms like MRSA, but also because they don't hasten the improvement in most cases, because most cases, now that we've done more careful studies and have the technology that allows us to figure this out, aren't even due to bacteria, but rather are due to viruses, which aren't helped by treatment with antibiotics. And so people are going to get better, these children, or with the ear infections, or most of the people, the vast majority of people with sinus infections, it's due to viruses, and antibiotics will have no bearing whatsoever on the outcome.
Thank you. Dr. Tyner, caller from Washburn, would like to know, how often do you need to get the vaccine for pneumonia?
For pneumonia, that's a fantastic question, and this one gets confusing. So the pneumonia shot, as a lot of the viewers will know, is designed to prevent a type of pneumonia. So pneumonia shot is a little bit of a misnomer in and of itself, in that pneumonia is a syndrome whereby your lungs get infected. Now, your lungs can get infected with almost any kind of bacteria. The pneumonia shot's against a specific type of bacteria called pneumococcus, and there are lots of types of pneumococcus. There's 2 different shots against the pneumococcus bacteria. In total, most people should have a total of 3 shots, but the sequence and which one to get when, it gets a little bit confusing depending on your age. So over age 65, everyone should have the pneumococcus vaccine. Under age 65 with certain risk factors, so if you have asthma, if you smoke, if you have basically any insult with your lungs whatsoever, some people who are welders, things like that, things to talk to your doctor about, should also have a pneumonia shot. And the sequence of those pneumonia shots is kind of on a case-by-case basis, but up to 3.
Thank you. Dr. Sanford, a caller from Superior would like to know, do nerve endings impaired by shingles ever get better? Or is there a way to treat that?
Yeah, well, like we talked about, when you get the shingles, that virus is traveling down the nerve and it just scalds and blisters that nerve. There are medicines that help to reduce the terrible savage pain, things like gabapentin and pregabalin. And narcotics, interestingly, don't really help a lot. But there are things that can be done. And eventually, that terrible neuropathy or nerve pain will go away. But sometimes it can take a long time.
Great. Dr. Stephan, one of the advantages of being a host is I can ask my own questions.
Ooh.
What about Zika? Are we all going to get Zika? Is it going to get up here to the Northland?
Probably.
I've actually been surprised with all the media hype that I haven't heard more questions about Zika from my patients. But it is present in the United States. And if you look at a map of the United States and where Zika cases have been diagnosed and reported, it might frighten people because you actually are seeing cases being reported from every state in the continental United States. Alaska has been spared so far.
Really?
But we have about 50 cases that have been reported, for instance, in Minnesota and about 40 in Wisconsin. But those are cases that people acquired in an area where there was a lot of transmission going on, typically in the Caribbean or in Central America and some of those areas. And then, because a lot of people vacation, they try to escape the cold weather that's coming. And then they brought it back with them, or they were visiting, down in those areas. But the only place in the United States right now that's having active transmission from mosquitoes is the very southern portion of Florida. So the Miami area, the Florida Keys. Now it's Miami Beach is kind of an area of activity. But even there, it's a very defined area in just the very southernmost tip, largely because the mosquito that bites and transmits Zika really is not comfortable in cooler climates. And so
that's good for us.
There's a limit to how far north that mosquito would want to travel even. And so I think we can worry about the mosquitoes that annoy us in the summer, but really that's more where it's going to stop. I doubt that we're going to see Zika in this far north.
Does the CDC have recommendations as far as travel then to Florida?
Well, people who are at risk for having adverse consequences, and that could be people with severely impaired immune systems illnesses, but particularly they're worried about pregnant women or women who might be contemplating pregnancy, because if you were to, they're finding that in pregnancy, if a woman gets infected, there can be serious consequences both to her own health and to the health of the developing baby. So there's a strong warning about any woman who may be pregnant or thinks she may be trying to get pregnant about delaying travel to areas where Zika is being transmitted, which now includes South Florida.
Thank you. A question from Hayward was wondering, do children get the same dose of vaccines as adults?
Wow, that's a great question for a pediatrician, as someone who trained in adult medicine. I'm not sure of the answer to that. Does any of my colleagues know?
I don't. My youngest patient's 80. I don't know. How about you, Dr. Stephan?
The shingles doesn't go to children. You get chickenpox vaccine for them, but for the shingles shot, it's different. Sound the same, but they're different.
We have a bunch of internists here who don't see kids.
I don't know.
I see them rarely, and I don't see them for vaccination recommendations.
I'd have to look it up.
Thank you. Well, we're almost done. Let's see. I can't remember where I was. Dr. Sanford, I think you're next. You've got to be next.
Oh,
so what's the final word on vaccines for you?
I love them as much as cheeseburgers.
Oh,
And
okay.
I think there are few things in our civilization that have prevented more suffering than vaccinations. Please vaccinate your family and yourself.
And Dr. Stephan, any words of advice from you?
In addition to vaccinating, I would say cover your cough and wash your hands.
Yes.
Oh, yes, washing hands. Great. Well, thank you all for being on our show tonight. Thank you for everyone who called in. Excellent questions. I'd like to thank our panelists, Dr. Paul Sanford, Dr. Kevin Stephan, and Dr. Harmony Tyner, and our medical student volunteers, Ashley Forstrom, Anthony Hacker, and Alex Sauer. Please join Dr. Ruth Wester next week for a program on women's health, when her panelists will be Dr. Breanne Brandt-Griffith, Dr. Jennifer Boyle, and Dr. Addie Lakari. Thank you for watching, and good night.